The head of the World Trade Organization told me on Monday she wants members to drop export restrictions on medicines, and that hasn't stopped countries from enacting them. The EU adopted export controls on COVID vaccines in January. Donald Trump signed an executive order in December that said vaccines made in America, I think the crucial thing there was made in America, should go to Americans first. The UK restricts the export of some 100 medicines that could be used to treat COVID patients. India's put controls on raw pharmaceutical materials in the early days of the pandemic. Moncef Slaoui led Operation Warp Speed under former President Trump. He's now the chief scientific officer at Centessa Pharmaceuticals. He joins me from Philadelphia. Also, I may say, looking extremely well, sir. Now you sort of, your Warp Speed is behind you. Let's grasp this thorny nettle of vaccine protectionism. It's inevitable, isn't it, that countries are going to not only hoard what they've got, but to try to take what others may be wanting or needing or entitled to?
Well, listen, Richard, first, thanks for having me. And this, unfortunately, is the result of a slow start of commitments by Europe that made availability of vaccine doses be maybe 6 weeks, 8 weeks later than they have been, for instance, in Israel or in the United States or a certain number of small countries, number one. Number two, overall, we need 8 billion people to be vaccinated, and we clearly only have a few 100 million doses at this stage. So such tensions and pressures are to be. The only way forward, frankly, is to design strategies whereby we can be better prepared for pandemics like this, and where we can be producing hundreds and hundreds of millions of doses much faster than we are today.
So when Warp Speed, you were negotiating, I was reading an interesting article about your negotiations and how you priced it and the various mechanisms by which, you know, they got so much money as long as it was successful. But the idea of actually going out and contracting to buy them, did you feel, sir, that it was a race to buy before somebody else booked that slot?
Frankly, at the time we did it, no, because the essence of our strategy was to incent companies to discover, develop, and manufacture the vaccine. As an outcome of that, we ended up with two types of agreement. One, which was the agreement we had with Pfizer, was to create a market opportunity if they were successful. They were taking the risk of investing in the research process. We were committing to acquire the first 100 million doses. For all the other agreements, it was the other way around. The US government took the research and development risk and financed either fully or substantially fully all the cost of researching, developing, and manufacturing the vaccine. And as a consequence of that, the first 100 million doses were going to be ours with certain options or more. So at the time of the agreements, it wasn't yet a race for... It preempted the race, frankly, okay. and put the US in the pole position.
Tough to face this, but the criticism of the vaccine rollout in the United States, I wonder whether it was inevitably just an oil tanker starting slowly that was inevitably going to pick up speed after the administration changed. I mean, be honest, sir, do you see that the Biden administration has made any changes that you think materially increased the supply of vaccines to Americans?
Well, let me start by saying that what we're seeing today is exactly the plan that was put forward, and that no one would expect that a manufacturing process would be turned over so quickly, so as in 6 or 7 weeks, you would see significant changes. The changes we see today are exactly the kind of ramp up that was designed to happen and is happening. It doesn't mean to say that what the administration has implemented will not have significant results going forward. I think in particular, continuing to encourage partnerships, for instance, between J&J and Merck for the fill finish, which was something that started also under the former administration, is very important. I think where the administration did the most was in mass vaccination campaigns sponsored by the federal government, which were not part of the strategy that the previous administration did.
What do you take from your time in government? You were criticised, you sometimes were vilified, your integrity had been questioned on several occasions, and yet at the same time you were also lionised and a hero because everybody realised you brought your GSK experience and arguably held the thing together and got it done. Now, with the hindsight, the scars and the bruises and the plaudits, what do you take from it?
Well, first, I would do it again in a heartbeat, because this was neither about me nor about an administration. It was about the pandemic and the people dying out of it. And I just felt compelled that it was impossible to try. Even if the outcome would have been failure, the key was to try, because it was plausible to have those vaccines. I also, frankly, I learned that politics is a field where the values I stand for are not always there. And it's all about the message in the short term. And that's why I'm so happy I'm out of that world and try to keep myself out of the politics. There's a bigger message I take out of it, Richard, which is that science, life sciences, research in academia, in biotechnology companies, in pharmaceutical companies, that ecosystem that exists is actually able to help save the world from this pandemic. And that's super important and extremely rewarding for me personally to have been part of it, for the thousands and thousands that participated, for the companies that put so much effort behind it. I'm so glad we were able to do it. I just hope we're going to learn even more out of having done it once.
And be ready for the next one, which I suspect you also believe will happen. Sir, thank you. I appreciate your time. It is kind of you to join us. I appreciate it, sir. Thank you.